statutory bodies that exist to you have to get approval from. So the process that we're working to
That's not dead bodies then.
is that the CCGs are writing this implementation business case for all the providers in North West London. So this will be a business case which sets out the capital required for the 5 major hospitals, for Charing Cross and for Ealing, for Central Middlesex, and for the GP hubs in all the 8 boroughs, and an investment in GP premises. The total cost of it is £1.1 billion at the current time. And it will be the largest business case the NHS has ever put together, and the first time the NHS has written a business case which says we're going to invest in every part of the health and care system in one go. So in the past it used to be individual organisations would do their own business case, and so you get a multiplicity of different things that didn't all relate to each other. The test that we have been asked to pass is all this investment in buildings affordable to the NHS going forward? And the first test we have to pass is that we can demonstrate that with the amount of funding that each of the CCGs has, we can afford the consequences of the buildings. Our plan is that the implementation business case will be finished by the middle of November, and it will then need to be approved by each of the CCGs, and we hope each of the providers. And then the plan is in January to present it formally to NHS England National Finance Committee, and by the time we get there we hope we have also engaged the Trust Development Agency, or the TDA, who is the body that looks after all the providers. And then when the providers are in NHS trusts, not the FT Foundation Trust, and the plan after that is it will go to the Department of Health, who will take it to the Treasury, and the plan is to get a decision, at least in principle, before HERDA, for the general election, on whether the government wish to invest in all the capital that we have asked for. And if we don't make it before HERDA, then very clearly we will have a very big ask of the new government in May 2015.
So just to ask one question on that timetable. Clearly we've just got an update today of the clinical strategy. We're not seeing the whole of the outline or implementation business case. When will the outline or implementation business case, whatever it's called, be available for the public, including ourselves, to scrutinise?
So we're hoping that in mid-November we're able to take it to the CCG's governing bodies. So I hope then it will be available in the public domain, or at least large chunks of it will be available in the public domain. I think some of it will end up being commercially in confidence, but as much as possible as we can, we will put in the public domain, because we think it's a massively important document, because it sets out how we are going to implement big service change in the NHS for the next 5 years in North West London.
So obviously, as the chair of this panel, we would obviously want you to come back with the most of the business case that you can, so that we have the chance to scrutinise that.
Councillor Mark.